It is 10 a.m. So we'll convene the meeting of the Dubuque County Board of Supervisors, Monday, December 7th, 2020, 10 a.m. Originating from the Courthouse, fourth floor Supervisors Chambers and via Zoom. And so we'll go to the agenda. And the first item today is considered the special COVID-19 meeting. And so we'll start with the work session to discuss COVID-related issues. And with that, we'll go to our director of our health department, Patrice Lambert. So Patrice, you're up.
Okay, thank you very much, and good morning, everyone.
Good morning.
Just going to begin. Good morning. I'm just going to begin like I always do and just give you a real quick rundown on our COVID and Iowa dashboard numbers. Dubuque County, as of this morning, we've had 45,167 individuals that have been tested. Out of that number, we've had 9,664 individuals that have tested positive. Out of that number, 7,031 have recovered. And unfortunately, we have 101 deaths in Dubuque County. The 14-day average positivity rate in Dubuque County is decreasing. It is now at 14%. Our hospital numbers as of, let's see, it would have been on Saturday, would have been the last update. We had 29 Dubuque County residents hospitalized somewhere in Iowa. We do know that both of those numbers are decreasing, probably still due to the holiday of Thanksgiving with our hygienic lab and our testing sites being closed. We are somewhat awaiting for those numbers to both increase. Hopefully they will not, but we are thinking that we still will see a rebound from that Thanksgiving early this week. Our long-term care facilities, fortunately, have now decreased to only 4 that are on a status of an outbreak, that being Shady Rest Care Center in Cascade, Manor Care Health Services of Dubuque, Dubuque Specialty Care, and Bethany Home. And also, well, I think we can just start with our slide presentation. I was going to add a little bit more with our dashboard, but I believe we have a slide that will cover that because they have really updated that information. Our newest White House report did indeed come out on Wednesday. Dubuque County and the city of Dubuque are still in those areas classified as a red zone, with the entire state of Iowa minus 2 counties are in the red zone for the White House report. Again, this report comes out every Wednesday. And then the next slide, Sam. Again, they always give us some information and guidelines to follow. They are stressing that we really need to take this report seriously, especially those 65 or older with significant health conditions. The recommendation is not to enter any indoor public spaces where anyone is en masse, because we know that, again, those are our populations that are we are finding that have the most severe symptoms due to COVID. And again, encouraging people to do that pickup delivery or just even have the groceries and the medications delivered to their house. And again, stressing that if they're indeed under 40 years old, we need to just have them assume that they were infected during the Thanksgiving period, because again, we know this is the age group, especially that 18 to 24, even up to 30 years of age, that are showing no symptoms whatsoever when they are positive. We encourage people to be tested. Again, Dubuque County is very, very fortunate to have 2 Test Iowa sites, as well as Hy-Vee and Hardig, that are all providing free testing. All of those do require people to go online, complete a survey, and make their appointment online as well. So again, it's basically just really encouraging people that this is serious. I mean, it has been serious, but again, with everyone still in that red zone across the state of Iowa, except for the 2 counties, we just need to really, really be stressing and also implementing those strategic mitigations. So the next slide, Sam. And again, in the dashboard update, the state of Iowa, or actually the Iowa Department of Public Health, with the governor's office, did indeed just update the COVID-19 dashboard for Iowa. And we just encourage people, please, if you have not been on the dashboard since these changes have occurred, please do, because there is so much more information that can be found. IDPH and the governor's office really want to share as much information as they can. Some people have said, well, it's a little late, but the way we see it, we're just happy that it's present now, because this is good information. Looking at, if you see the state of Iowa map, you can go right over to Dubuque County, or basically any county that you're looking at, click on that, and it will filter basic information for that county. So now included are the current 14 and 7-day average for positivity rate. Also, it shows the total and the percent positive cases of that county. And now it is also counting multiple tests for an individual. As you know, in the past, they only counted that person once, but now they are counting the multiple tests. So approximately 36% of the Iowans who have had a COVID test have tested at least twice, and many have tested multiple times. So again, we're very fortunate that we do have the testing capability with our sites in Dubuque County. And again, we are fortunate that IDPH is now showing us more information on that dashboard. So again, if you have not been on it, we just encourage people to take some time, click on it, and then go right over Dubuque County, click on that. It will filter much more information that pertains specifically to Dubuque County. The next slide, Sam. Also this past week, Iowa Department of Public Health decided to follow the CDC new guidelines for quarantining period. So now it still recommends, the CDC does still recommend a quarantine period of 14 days. However, what they were finding was that people were not really abiding by the 14 days. They also looked more closely at when the contagious time frame would be for an individual that tested positive. So last week, based on all of that, they now have changed their recommendations, which the Iowa Department of Public Health has also decided to follow, and as will Dubuque County. So we now can inform people if they have been a close contact with someone who has tested positive, they can end their quarantining after day 10 if they choose not to be tested and if they have no symptoms whatsoever in that 10-day time frame. They also now have a new possibility that if they have been deemed as a close contact and have been placed in quarantine, if they choose to be tested from day 5 or day 6, before that day number 7, if they choose to be tested and if that test comes out negative, and again, they have absolutely no signs or symptoms whatsoever, their quarantining can actually end after day 7. So we know that it is a shorter time frame, but we do believe that people will be more in tune to follow these new guidelines. And then if that person who is in quarantine does go in for a test, and if they are positive, then indeed they would have to remain with the isolation guidelines that would be given to them per Iowa Department of Public Health and our local VNA, because our Visiting Nurse Association continues to do our contact information, our contact tracing with the individuals in Dubuque County. Randy Gale, I know, did place the Iowa Department of Public Health newly developed map or diagram in our daily update yesterday. And we will be placing that, oh, thank you, Sam. We will be placing this flow chart on our Facebook as well as our website. And we will be sharing, we have shared the narrative, but we will now be sharing this flow chart with all of our schools, pre-K through 12, as well as our higher ed as well. So again, this chart is basically, again, showing you what I have said narratively, that if you are a potential COVID exposure person, then you start quarantine. If you're symptomatic, you need to immediately start the isolation protocol. If you are asymptomatic, you then need to go into quarantine, but then from day 5 or day 6, if you go in and be tested, and if that test result comes back negative, then you are able to end your quarantine at day 7. If you choose not to be tested in that 10-day time frame, then you do need to wait until day 10, and if you're presenting no symptoms, then you can end your exposure after day 10. So the next slide, Sam. Again, we know we can't share enough with the public just to be cautious with our next 2 holidays approaching us. We really, really are stressing. We know it's going to be difficult, but please only celebrate the next upcoming 2 holidays with the people living in your household. Please be creative and do virtual family gatherings. We really are telling people, because we do have some unusually nice weather right now, we are telling people to get outside. You don't have to remain in your house, but when you do go outside, you can go for a walk alone. You can even visit with your neighbors if you stay socially distanced and you have your mask on. We know that the weather will probably be changing here soon, and we will all have to stay in our house. But for right now, we're telling people, even for your mental health component, just get out and enjoy some of this nicer weather. You don't have to stay under the roof and the walls of your own house, but we do encourage people to get out, but again, follow those social mitigation strategies. Please do try and do a walk, wear a mask, walk alone, or with the people who live in your household. And if you can, get out. I don't know if your lawn still needs to be mowed or whatever, but do some activity while we are able to be outside and follow the safety mitigation strategies. So the next slide, Sam. Again, this is just a month in a review. As you see, August 7th, we had 1,600 cases. September 7th, a month later, we went up to 2276. A month later, we climbed to 3996. On November 7th, we went up to 7,060 cases. And now we are showing an increase in this past month of 2,604 COVID-19 cases. The next slide, Sam. We, as we've done every Monday, updated our zip code data. This will be shared with our city clerks and with our mayors throughout the county. This slide is just showing the comparison from the totals from last Monday to this Monday. The orange bar is last Monday count. The blue bar is this Monday count. So our total numbers have increased as far as cases. Our total recoveries have increased. Our total deaths, unfortunately, have increased by 10 in just 1 week, and our active cases have decreased. But again, we are basing that still with our Thanksgiving holiday. We know, talking with our 2 test Iowa sites last week, Monday and Tuesday were somewhat slower days, but then they did bounce right back into their regular testing appointments on Wednesday, Thursday, and Friday, which we will probably start seeing, if we have not already, a lot of those cases being reported. The next one, Sam. And this is, again, a comparison of the total active COVID-19 cases per zip code in that 1 week time frame. Last Monday is again the orange bar, and then this week are the blue bars, which are the numbers, as you can see, are basically across the board much lower than a week ago. So again, we do have a couple of our towns that have had either 0, 1, 2, 3, or 4 cases that we have to identify as a change less than 5. The next case, Sam. Okay, this is, again, the total cases per the zip code as of today. Again, we know that last week was somewhat of a lower week, but we really are, we're hoping we're wrong, but we really do believe that our numbers will be changing this week for the increase. And this slide is the percent of our positive cases per zip code based on the population size. And Farley continues to be the highest percentage. However, Dyersville and Sherrill Balltown are not too far behind. And again, all of this will be shared with our city clerks and with our mayors. And then our last slide, Sam, our sources and links that we do always, Sam always finds some good links to put out. And we hope that people will go to those sites if they do want to have some additional information. And then the only other item that I wanted to report on this morning was that the incident management team continues to do a vaccine planning. We are very aware that Iowa Department of Public Health and CDC has been telling us that vaccine could be released to the state departments basically a week from today. We do feel very confident that we do, by working with all of our hospitals and our healthcare providers and our long-term care facilities, that we do have a plan in place when we are notified of X amount of doses that will be coming to Dubuque County. We don't anticipate a large amount, basically, for the month of December, but once we do get the FDA approval for our vaccine manufacturers, we know that that vaccine number should start increasing as far as the doses that will be distributed throughout all of the states, including the state of Iowa. The long-term care, we are very fortunate. They are working in conjunction with a pharmacy that will take care of their doses, as well as the administration for their residents and their staff. So we will then be working primarily with our hospitals and with our healthcare facilities, and then as time goes on, with the general public. So that is all that I have for this morning. If there's any questions. And I don't know if Stacy was able to join us. We had a conflict. We have another meeting going on. Oh, she is able. She's on as well. I'm sorry.
Trace, Dave Baker here. There's a couple things from chat. It's the first one is asking about the participation rates in contact tracing. What percentage of people with positive tests are not cooperating?
And that would be a Stacy question.
Okay.
So she and her staff do make the contact tracing calls.
Okay, then let's go to the next one. I'll hold that one for Stacy.
Sure. Okay.
Okay. This is, and this is actually from Tammy Freiberger, our interim administrator at Sunnycrest Manor. So it's regard to testing strategy and potentially discontinuing the quarantine prior to day 10, but not before day 7. Asking you, Patrice, if there's an indication on whether the rapid test is acceptable. And Tammy believes that it would be based on the PCR test. So do you have any information on that?
I can double check that and get back to Tammy, but that is my understanding as well. But I can double check and get back to you, Tammy, if Tammy's still on. But yes, that is my understanding, but I will follow up with that.
Okay, and I think we would appreciate it, Patrice, if when you follow up with Tammy, then follow up with the supervisors and other administration folks, and then see if we can get that into your report for next week so that the public knows about the information as well. Thank you for that.
I will do that.
Okay,
sure.
Thank you. Any other questions for Patrice?
Good morning, Patrice. Ann McDonough. You commented about the dashboard including the multiple tests, the 36% of Dubuque County people who've been tested more than once. It's my understanding that the multiple tests are not being used to calculate positivity. They are just being reflected as a number being shown, but they are not being used to determine positivity rates. That's correct, right?
Yes, correct.
Okay, so it's interesting and it shows the amount of testing that we're doing, but the positivity rates continue to be calculated by a formula by the Iowa Department of Public Health. It's not clear how they actually do it, but you know, it's far too high all the same, and glad to see it coming down. The question about the convalescent plasma, who can answer questions about that? Who's taking the lead in the incident management team on that? Is that Stacy?
Actually, all of us are.
Okay,
So do you have a question?
Yeah. The question is, it's kind of like contact tracing. We're saying that we're doing this, that we're indicating people and contacting people that they should consider donating after they've recovered from COVID. But who's doing that, and what numbers do we have? Who's reaching out to ask people to donate? I know the local hospitals are supplied by Mississippi Valley, which I think would probably be our primary get, you know, the plasma to Dubuque County residents at the hospitals. But who's actually making those phone calls?
Sure. I can answer a little bit, and then I know Stacy will go into more detail. But as Stacy and her staff are making contact, they are encouraging people to be tested. Or I'm sorry, not to be tested, to be donating, to consider to donate their plasma. We have also contacted the IDOT for their messaging, and I was not able to contact them until the end of last week, asking if they could assist us. As you probably have noticed, they've been doing a lot of messaging for us, asking if people could or would consider donating plasma if they have tested positive. We do encourage people whenever they call. We always tell them to call the center first because of the criteria that is needed. That being that they have to be at least 17 years of age, they've had to have tested positive with COVID, and they have to be 28 days out.
Right,
So,
and that's my concern, actually. They have to fit a criteria 28 days out. And so a phone call being made, when is that 28-day call being made? I mean, we should be targeting folks. We have a dire need for this in our community. And what are we doing to kind of target the population? We know they've tested positive. I mean, I don't know, but y'all do. What are we doing to catch them around that 28-day mark?
well, and I know one thing, and if Stacy may have some additional information, is that when people do call in, you know, if we tell them to please call and make that appointment, a lot of the centers are indeed making those appointments. whenever those 28 days or whenever that person is beyond those 28 days. So I don't know with the centers if they actually do a follow-up reminder appointment call or not. Stacy may have some more additional information on that as well.
Right.
But every
I have-
chance we get, we are
Sure,
asking people to
sure.
please donate.
And I'm asking you or someone to take this very seriously and make this be big. It needs to be bigger. We need to look at how we can do this differently. I've spoken to folks who they're highly educated people and they had no idea about 28 days. They have no idea about any of this, or that, you know, it's something that's needed in our communities. So I don't know who can follow up with that. Maybe that's Stacy and her team, but this is a gap that we're seeing right now in our community. And you know, that's the only thing positive I can think of about the high positivity rates we've been experiencing, is that if we make a call to action, I think citizens will respond and become donors and help those who unfortunately may be hospitalized in the near future.
And the Board of Health did have a lengthy discussion on this at their Board of Health meeting last week as well. There was a suggestion, would there be any way that we could actually pay people to donate? We know that one of the centers does pay for people to come in and donate their blood, but that center really does send their blood donations more out of the county.
Right. And Patrice, we have followed up on that, Ed Raber and myself, and spoken to Mississippi Valley. There's no further incentivization that can be done and still comply with that's their impression, their higher level folks saying that that's not a possible thing that they can do. So, you know, I don't think it's worth kind of going down that road. We've explored that. Really what we need to do is a public awareness campaign and that citizen ask and call to action. And that's not about paying people, that's about spending money for marketing and advertising, perhaps. I know the city is doing some things, and Ed Raber's following up with them aggressively. So I would like to have it be, though, that it is a topic that's discussed about what we're doing. I intend to ask it every week of you, what we're doing and what our numbers look like and who's responsible for making that, I don't know if it's a second call or what it is, to folks about the 28-day mark.
Sure.
Yeah, I have a question, Patrice, and then maybe just a first kind of a question and comment on the current topic that we're talking about. And so if the Board of Health and the Board of Supervisors is interested in having the recovery plasma be a big component, what I would be interested in knowing is what is the need? What is the demand? Is it 10 units, 1,000 units, 10,000 units? So that's the first thing to maybe educate ourselves and or the public. And so if you can generally categorize that for me, that would be helpful. My question is really on hospitalization. So can you comment a little further on just one, the overall hospitalization whole number, the trend line you're seeing, and then comments related to capacity?
Sure, and we meet again with the hospitals for sure once a week, if not twice a week, and we will be meeting with them later today. But the last that we had gotten a report from the hospitals, they are maintaining. They're maintaining both their beds for their patients as well as their staffing issues right now. Again, not just Dubuque County, but primarily throughout the state of Iowa, the hospitalizations have decreased this past week. But again, no one is letting their guard down. So we continue, the incident management team continues to work with both hospitals with their incident command team on looking at the various staffing issues, as well as still looking at an alternate care site. But again, we know we can have the best alternate care site if we do see the hospital surging, but if we don't have staff, then it's not going to do us any good. So the discussion last week primarily, again, was focusing on the empty, not really considered empty, but we consider it empty spaces in the hospitals that we could possibly provide more beds and more equipment. But those talks continue. Like I said, for sure, once a week we're visiting with our meeting, not visiting, with both hospitals, if not twice a week.
Okay, thank you.
Okay, any other questions for Patrice? Patrice, I think the discussion about, I guess, financial incentives for people to donate plasma, I believe may have come from someone at the state level, possibly an elected official. I just wondered if there was any discussion at the state level with the governor. They have a surplus, if that would be the appropriate place for something of that magnitude.
I can check on that as well.
Yeah, thank you. Any other questions for Patrice Lambert? We'll then go to Stacy Killian for her report. Does anybody know if Stacy's on with us?
I am. Can you hear me now, Dave?
We can hear you, Stacy. Go ahead.
Wonderful. So just to go back to the questions that were asked, David asked about in the chat, there was a question on the percent of positive cases that are cooperating with contact tracing. I don't have that number. I'm not certain with the new system that that's one that I could get, but I will check with the state and see if that is something that they can provide. They have access to a lot more reporting than we do, so that might be, with our partnership with them for contact tracing, I wouldn't ever be able to get an accurate number. I could only do it with what our staff makes the calls on. So let me check with the state on that, and I will get back to you guys on that question next week. And then the other question that Ann had brought up about the plasma. So we are trying to get more information out to all the positives, as we call them, regarding plasma donation. We are also, I know Iowa Department of Public Health is as well. In terms of Ann's direct question on reminders at the 28-day mark, we have not done that. It's definitely something that we could look into doing, I think. Right now, the case numbers are still down a little bit, so on a capacity basis, I think we could try making some of those calls and report back and see how that goes. So I will work on that this week and try and get that going right away, and then report back to you next week on those as well. Just for our update, when I last ran the report, we from that time to today, we have 9,664 cases, which is an increase of 423 for us from the time of the two reports. It's down from the week prior at 584. We are starting to see the numbers kind of go back and forth a little bit, hovering right around 50 to 70 a day, just depending on the day, which is definitely lower than what we were seeing, which is encouraging. We are continuing to follow the 4 long-term care outbreaks that we have. We are still doing the daily follow-up calls. Additionally, we're also providing daily follow-up calls to 8 other facilities, including some of our independent living that are not considered long-term care. So we are also doing daily follow-up calls with those as well, whenever we find positives in the facilities that need some public health assistance. We have had 30,255 calls in the community. It is an increase of 553 from the previous week. So we are starting to see our calls creep up a little bit more. Certainly not at the higher levels that we were seeing in mid-November, but we are still staying steady. As you know, from the information that Patrice provided, there was a guidance change on quarantine. We are currently working with Department of Human Services as they direct the child care centers here in Dubuque County. So we're waiting for their guidance to change as well to match what Iowa Department of Public Health has. So currently, until we see that guidance change, we are recommending the 14-day quarantine for the child care centers, as DHS is who they follow. So hopefully that will that will soon be changed to match what Iowa Department of Public Health is also recommending. So we are continuing our daily calls with the schools. That has not changed at all. Our communication has been really wonderful. Our schools are doing a great job at mitigating exposures within their facilities and in communicating with public health. And staffing levels for VNA, we're finishing our interviews for a PRN contact tracer. And then we are sending out an offer today for some of our RN positions. So it's very encouraging that we're continuing to move forward with adding staff as needed. Additionally, I thought I would share that looking at the number of staff hours that VNA has had towards COVID, mostly contact tracing, but also our daily follow-up calls, things like that. In October, we had 585 staff hours go towards COVID. And in November, we had 885. So we had a jump of 300 hours in November, which does not surprise me looking at the number of cases we had at the first 3 weeks into the month. So just thought I would share that number. I think it's interesting in looking at how many hours it's taking to go through the contact tracing and all of the boots on the ground work that we're doing. So I appreciate all of your support in all of this, and it's been tremendous to help us keep going with what we need to do. So thank you.
Thank you, Stacy. Any questions for Stacy Killian? Okay, I'm gonna.
None for me.
Okay, thanks, Jay. I'm gonna jump back here. I did get another message from Representative Eisenhart, and let's see. I'll just read it. Supervisor Baker is correct. As I shared in the past, the governor's office indicated to me that counties, or anyone else for that matter, can request funds through her office for pandemic response. Doesn't guarantee a positive answer, but I was told that is the process, and availability of plasma may also be a procurement issue that the emergency management and FEMA can help with. So when we get to perhaps Tom Berger can help with that. And Patrice, I don't know if you have, if that's something that we've asked about, or if there's a discussion. I think Supervisor Wickham asked a practical question, asking about what the numbers are before, jumping in with both feet, assessing the problem first. So have we done any assessments along that line?
Actually, this is Patrice. I know Ed has been following up with what's available at the hospitals and sharing that. But again, when we're on our hospital meetings, we'll be glad to see what the supply is. And with the incident management team, we sure can work with Tom to submit that request to the governor's office as well.
Okay. Why don't we, with this, it looks like our vice chair of our Dubuque County Board of Health, when we get to her report, has some input on this and some clarification. So we'll let Diane Pape Freiberger speak on this when we get to her portion of the meeting. So
I might, Chair Baker, I think Ed Raver might have information as well. I know he spoke to Mississippi Valley about the supply they have on hand. He might be able to give us an update. I know he's been actively working on this the very last part of the week. So Ed, do you have anything that's relative you'd like to share here?
Thank you, Supervisor McDonough. This is Ed Raver. I was able to have a conversation with the marketing director from the Mississippi Valley Regional Blood Center last week. They do supply our local hospitals. In conversations with the incident management team, the Red Cross may also do some of that. Some of their stuff may also go to other areas. The way this has worked is that the Mississippi Valley Regional Blood Center would welcome an opportunity to partner with the medical providers, the county, anybody else to do some additional public marketing. I think that that he also thought that the best case scenario is what VNA Director Stacy Killian pointed out, which is they have all the positive names, and if that's a thing that you can get in the routine of after whatever that is, 28 days, trying to recontact as many of those individuals as possible, that would be a great way to just remind people that this is a thing that could that they could contribute back into the community for, whether at whatever location they felt most comfortable, whether that's Mississippi Valley, Red Cross, BioLife, however you'd like your contribution to be made. And he did not indicate that paying additional money or any money was something that they typically do or were interested in, or that they felt like was a way to attract more people. He felt like it was just an awareness issue. So I've also, in my conversations with, not directly with the hospitals, but through our communications contacts, it does sound like, at least at the incremental time here from the beginning of last week to the end of last week, the daily supply of convalescent plasma at the hospitals was increasing. That's also at a time when hospitalizations are slightly going down or stable. So having a multiple day supply of that is what they're really after, and it was better at the end of the week than the first time I checked at the beginning of the week or the end of last week. So having that as a information point when we have contact with our partners at the medical facilities, asking where they are with that will be an important thing moving forward. And so we'll continue to just try to make sure that we're aware of what that is and communicate that to you in a way that is helpful to figure out what we need to do next. I'll continue to try to work with Stacy Killian behind the scene to get an understanding of how that's going in the practical application of those recontacts of people that are at 28 days.
Thank you, Ed, for your report. Okay, any other questions for Stacy Killian or Patrice Lambert? Supervisors Wickham or McDonough?
No, thank you.
None for me.
Okay, thanks. We'll move on. Next up then would be our emergency management. Excuse me, I didn't mean to skip over Tammy Freiberger. Sunnycrest Administrator update, Tammy Freiberger, our interim administrator at Sunnycrest Manor.
Oh, that's okay. Good morning, everyone and supervisors. I don't have too much to update today. In our level 1 monitoring area, like if they came back from the hospital and we're monitoring, we have 0. Our level 2 area where it would be our, symptomatic or awaiting confirmation of a test, we have 0. Our COVID area, COVID positive resident, we have 0. We continue on with our twice weekly resident and staff testing. So we do those clinics on Monday and Tuesday, and then on Thursday and Friday to suffice our twice weekly regulations. And we had 0 positive residents this morning, so none, and also 0 positive staff thus far. So we don't know what the week will bring, but so far so good. And we know that can change in a moment. So we just continue testing. So that's all I have.
That's the kind of report that we like to hear, Tammy.
Oh,
Thank
we
you.
like to live it.
All right, any questions for Tammy Freiberger?
None for me.
All right, thank you.
Thank you.
All right, now Tom Berger for the emergency management team update.
Morning, supervisors. I don't have too much to add from what Patrice had already said for the incident management team, but I did take note of a couple of them comments. I have not seen on our web EOC portal where anybody's requested plasma, nor have I heard from the hospitals, that's a route, but I'm going to shoot an email off to the Homeland Security and Emergency Management, see if that's something that they would get involved in. if they have any information on it. So I'll try to follow up on that. So. And
Okay, Tom, any questions for Tom Berger?
No, thank you, Tom.
thank you.
Okay. Testing update is the next item. I think we've covered quite a bit of this. I'll make a comment. I think we get to this and a lot of the data has already been reported, but this, as you will recall, earlier in this pandemic, this Board of Supervisors and our staff and our Board of Health and Health Department really pushed for additional testing, because when we had these real low numbers in our county, I think looking back, it's pretty easy to figure out we just couldn't get tests. And so this item on the agenda is probably a victim of its success in that we do believe we have adequate access to testing. I would like to see something in the western part of the county, but it's a little inconvenient. We did have a pop-up thanks to the Hardigs, and I know that Ed Raber had his head in the tent on that as well, and it was I would say successful. I think there was about 50 people got tested out there, but it didn't cause a traffic jam either on the other hand. So I think we have good availability for testing in Dubuque County. I guess that's subjective, but we're certainly in a better position than we were when this thing started. And I really give Supervisors Wickham and McDonough, our board, a lot of credit for that. I think we, as a team, pushed hard for that. So,
I do have a question actually to Ed. As we look at testing, I agree with you, Chair Baker, about getting something to the western part of our county. It might be, every day is a new day in terms of people realizing they might need testing. So I would explore again, maybe with the mayors. I think they're every day for them too, more aware of the need coming closer to home. It might be wise just to inquire if they feel there's a need for something that is more convenient to the western part of our county and what their ideas are. So maybe let's not just rest or pause, but ask that question again to see if there's something we've maybe overlooked.
I believe that's a good point. Thank you, Ann. Any other questions or comments on testing? Okay, we'll move forward. Board of Health update. As I previously mentioned, our Vice Chair, Diane Pape-Freiberger, is available. And Diane, we'll turn it over to you.
Thank you, Chair Baker. First thing I would like to make a comment on is the testing that we just got finished with that conversation. I was on the meeting that Patrice had presented to Dyersville. And at the end of that, she had offered to them that if they had wanted another pop-up site or an increased testing out there, that she would, and the incident management team would also explore that. So if that is a request of one of the remote cities, I would suggest that they make that request to Patrice, because I do know that in conversations that I had to get Charlie Hardig out into Dyersville, that he had said that he would be willing to, if he had time, he would have to have 2 weeks to prepare this. And he would also like volunteers from that community to help out, like with traffic control and those kind of things. They did promote that for 3 weeks in Dyersville, and they got no volunteers. I actually was out there that day with them. They'd had 55 that tested. The majority of those from their license plates actually came from Delaware County, which is part of Dyersville also. But, you know, if they feel that their communities would like that, then we would also have to take a look at now, because of the time of the year, you know, they had it outside, and we have our signs are somewhere is up in Rickardsville, you know, it was that windy that day, but they would have to take a look at inside areas where they could do that, which he would be willing to do that. We also have to remember that testing is through HHS, and that's a federal program that is actually due to expire at the end of December. They do not know whether, you know, that's going to be continued on starting in January, or something even better that's going to continue. But he does need to have some time to set that up. And there may be others now that Hy-Vee is also doing the testing through their pharmacies, that they would be willing to do that. And then as far as it is not in your written update from the Board of Health, but and I have to thank the conversation on convalescent serum, because this is near and dear to my heart. And I have had some conversations with both Ann McDonough and Ed Raver early on with this, when my sister was in the hospital and could not get the convalescent serum because it was not available. So I actually have done a lot of marketing on my own to get individuals to donate for the convalescent serum. With that, Samantha Clough has made contacts, just like Ed Raver apparently has, with each of those 3 facilities in Dubuque that receives plasma from the public. What I'm hearing back from those people individually is that they had chosen one specific location to donate their plasma because they get paid there. And so it was another trying to get them to think, okay, let's do this for the community instead of for pay. But some of these individuals have been off work, or their income has been decreased. And so they do this for the money, and that location actually does not keep that plasma local. So I do know that, you know, Representative Eisenhardt had sent an email out broadly, but this is actually from personal experience that I have found this out. And so at the last Board of Health meeting, I had asked Patrice to look at grant monies. And so I appreciate her having help from Tom Berger to check into this, to see if there is some, and it wouldn't have to be necessarily even to pay for each of those donations to the individuals, but to get the marketing out there that we are all in this together, and we need to be able to help each other out, because they are finding that the convalescent serum does seem to help the individuals that are receiving that. And so with that, I have already told our chair, Tom Beshan, that I want that on the next agenda. This is,
If I
but
could just join you, Diane, in the conversation about this, Supervisor McDonough here, but the fine line is that Mississippi Valley offers an incentive, which is a gift card. And it's been explained to us that you can't pay people to donate. You have to use incentives, there's workarounds. So I wouldn't want us to think that the county is intending to pay people to donate. We have to move inside, you know, those regulations, right? We want to make sure that our conversation and everything is going to fit with, we wouldn't want anyone to think that some folks are being played. We do have for-profit centers that offer different types of payment and incentives, but it's a difficult thing. And in some folks do keep it, the plasma is kept here, and others don't. It's used widely. I know that there was Mississippi Valley was collecting plasma in Madison late last week for use here in Dubuque if needed. So it's a regional effort as well, but I don't want to chase down the paying people thing, so that we're losing the, as you suggested, the marketing and the outreach is what we really need to spend the effort on.
And thank you for that comment. And I have heard since then from individuals that are in the hospital, they cannot receive the convalescent serum like day 1, day 2, day 3, because they're still waiting for that to come. Plus, some individuals are being discharged without even having it. So yes, we do need to get individuals to donate in the community, and the marketing does need to be accurate. The one thing that I would ask is that if Ed is working on this, that he also coordinates that with either the incident management team or Samantha, because from a Board of Health standpoint, I was having Samantha, check into these things and get these things outlined. And so rather than having multiple entities checking into this, it would be better if it's all coordinated. That sound accurate? Okay.
Well, yeah, I would
just
agree.
like what-
I think the coordination is better, but we don't know what Sam's being asked to do is the difficult thing. So, if Ed and Sam were working together on a daily contact, that might, make everything more efficient probably. I see Ed nodding his head.
And just a comment, I personally feel that this is strongly, I feel this way, is a public health issue. In fact, there's very few things in the community that are not, public health issues. And so it would be probably a good connection to have that conversation with the public health department, especially in the middle of a pandemic. So, and at this point, I still put the call out to, and I continue to call people that I know and pass the word on through my, I've got a network, of healthcare professionals to get that call out. And so they, there were 7 people my first day that went in and donated. That means 7 times 4, because each of those donations can be split 4 times. So, but I thank you for this conversation. It definitely needs to be on the forefront. I just ask that it's somehow coordinated with the health department. And you come back to me if there's a barrier in doing that. I will suggest it then. As far as the Board of Health meeting on Wednesday, December 2nd, Tom Beshin had not put that in there, but we did have a conversation on that. Our budget was reviewed, our preliminary proposal, and each one of us was asked to consider and provide input this week and get it to Tom Beshin to be able to give input on the board. And then we're looking at approving it or first discussing it and then approving it at the December 16th to be able to forward it on to you as a Board of Supervisors in a timely manner. Spending authority, we had a lengthy conversation on that, and I am the one that actually had brought it up 2 meetings ago that that Patrice and the health department should have those available funds. And I know that last week that was considered extension of our authority to be able to authorize that. And that was decreased to $10,000. I still, we had this discussion last week. And so we are requesting a work session with the Board of Supervisors in the near future. And Tom Beshin has been in contact apparently to set that up. The difficulty could be in the timing of that, to have many Board of Health members present, is that we have quite a few of the Board of Health members that are actually working during the daytime. But Tom Beshin is coordinating that.
Right, Diane, and again, I think there's some there's confusion about what the board actually did. What we attempted to do in response to a memo from Ed Raber was to give Patrice swiftness and the ability to execute her own direction, some extra funds. We weren't attempting to put extra hoops in place. And so, I mean, that's certainly what my vote was, to say Patrice needs some spending authority that she needs to be able to go with as an administrator when things come up on non-Board of Health days. So that was the idea here. I think it kind of got, waylaid at the Board of Health, your general discussion. Certainly we're not expecting you to not bring your ideas forward that need to have, budget consequences. I think certainly I expect you to do that. But, you know, my vote was not to say you can't spend more than $10,000. So I'm not sure what the miscommunication is.
This is Supervisor Baker. Diane, I agree with Supervisor McDonough in that I viewed the vote on the 10,000 as I've used the term, when we've moved money into the Board of Health budget, it's equivalent to at home moving that from my savings to my checking account. And we had in place where the Board of Health would approve something and you would come to the Board of Supervisors, regardless what the cost was. And we opened up to 10,000 that, the Board of Health or Patrice can go ahead and make the purchase and then bring it back if it's up to 10,000. And I think it should be resulting in being more nimble, more reactive, up to 10,000. And I think what I had said is I think any permanent solutions that you have, I think we should have Supervisor elect Potoff involved in that, and that would be after December 31st when my term expires. But I was willing to make that change as an improvement, and I think it's better than what we had. And so that's may not have been the way it was taken, but we can't help that. But and the discussion that led up to that for me was we were talking about something as simple as getting posters printed, maybe a few $100s, and to wait 2 weeks for that is just crazy. So that would give Patrice the ability to go get the copies done and not worry about coming back to the Board of Supervisors. So, but we did go up to 10,000. So I view it as an improvement. Okay, any questions for Diane?
Dave, I'll finish the report. The next thing that we discussed was that we have 5 board members that will be expiring at the end of this year. And they all received letters. And I think that today was the deadline for them to fill out their application if they want to be considered by the Board of Supervisors to continue on the Board of Health. That's the date that I didn't see the letter, but that's the date that they had said they're going to do. We had some discussion on should we juggle the expiration dates? Should we make some of them extensions for 1 year or 2 years so we don't have 5 expiring at once? We all decided that we voted that we should keep it the way it is for right now. And then our next meeting will be on December 16th, 2020 via Zoom. Now, any more questions?
Okay, I'm not.
None for me. Thank you,
I'm
Diane.
not seeing or hearing any. Thank you for your report, Diane. Okay, we'll move on. Next item on the agenda, updates from Dubuque County municipalities. Somebody can perhaps help me and let me know if we have any of our mayors or city council representatives from Dubuque County that want to give a report. Okay, I'm seeing none. We'll move forward then. The next item on our agenda, and we're pretty close to being on time here. We have an 11 a.m. work session with Sheriff Kennedy to discuss the jail dormitory renovation. So Sheriff Kennedy, we'll turn it over to you.
Thanks, Chair Baker. Good morning, everyone.
Good morning.
I just wanted to give everybody an update on what's going on with that project. We got our specs and everything completed, and we were able to send out the RFP last week. We've got a day tomorrow where contractors are going to be allowed to come in and view the project, with the bids being due on the 17th. We're going to be opening those bids. If I'm not mistaken, I think they bidding closes at 3 on the 17th, and then we're opening bids in the Board of Supervisors chambers at 3:15. We've got a public hearing, I know, next Monday during the Board of Supervisors meeting for anybody that wants to speak on the project. So yeah, I mean, that's pretty much where the project's at. I know initially when we came to the board, they thought that the project was going to be approximately, I want to say it was $710,000. The latest bid that we got, or the latest projection that we got from our construction manager, was about 685. So, and he feels pretty good that right now, with everything that's going on, there's a lot of companies that are hungry for work, and so he feels pretty confident that we're going to get a pretty solid bid out of this. So yeah, I guess. Do you guys have any questions? I guess one thing also, just so you're aware, I know one of the issues surrounding the project was the inmates and movement of inmates while the project was in progress. Today we are at 144 inmates in the jail. We feel as long as we can keep it around in the 130, 140 range, that we should be able to house everybody within our jail while that project goes on. If it gets over 140 by a significant amount, then we're obviously going to have to ship people out. So yeah, but that's about the most I have for an update. Are there any questions?
Sheriff Kennedy, I have some questions. Chair Baker, you're muted. Did you? I do have some questions. All right, if I proceed?
Go ahead, Nan. Yep.
So the amount of money that it's going to cost the county to take inmates and house them differently while the project happens, that's not in that 685 number, correct?
That is not. That is correct. And then if you recall, I don't know if you have the paperwork from when we came and did the work session for the project initially. So we had it figured up, for every 10 inmates that we have to house. The project is projected to take 8 weeks per housing unit. So if for every 10 inmates that we have to ship out, we estimate that it's going to cost about $35,128.95. That includes the average housing costs per day being at $57.50, which is a number that we came up with because most jails charge between $55 and $60 per day per inmate. And then by averaging in just any cost of transports, obviously we would try, if we had to ship inmates out, we'd try to get people that didn't have any upcoming court appearances anytime soon, but we can't always guarantee that. So that would also include, us paying employees to go pick these inmates up and bring them back for court hearings and things like that.
Okay. The overall project schedule is to begin when and end when?
I think so. That's going to be dependent upon availability of materials. We are hoping that the project will start in April, but we, depending on material availability, we may not be able to start till May or so.
Yeah, we'll need to put some money into the budget, probably to house people. I mean, it's a steady climb in our inmate numbers, and as you and I have discussed many times, we don't decide that. The sheriff's department doesn't decide who's going to be in the jail. We just respond to other people's decisions. So, but,
Right. Well,
I still,
and
I still
oh,
support this project. I think it's necessary to take us to a better space.
and I think just you know, in all transparency, I think at the end of this fiscal year, you know, we are probably going to be looking at enough of a budgetary surplus that it should be able to cover any housing, and you know, if not, most of the with the project being this late in the year, it's something that we could possibly take money out of bottom line for next year's or for FY22 if needed. We do also know that there's a couple areas where we can cut some costs to the county if need be, by using forfeiture funds. So that's also something that's being explored. Obviously, that's not something that we would 100% want to do, but if we had to do it, you know, we would definitely do that. So
Thank you.
yep.
Sheriff Kennedy, Supervisor Baker, you had mentioned that contractors are given the opportunity to physically view the facility. I guess I found that curious. Are contractors actually going to be on site? And I guess if so, wanted to make sure that the proper protocols were in place for having, 144 inmates gathered, the protocols that would need to be in place for outside visitors. I'm assuming that that is taking place, but I'd like to hear that so that folks listening to this or covering this for the media wouldn't think that we're traipsing a bunch of folks through the facility.
No, I have no problem answering that question. We obviously, the health and safety of the inmates is one of our top priorities here. So, we understand that when people come in from the outside, that they need to follow proper protocols, wearing masks, and we'll even have them wear shields while they're here. We have hand sanitization locations throughout the building, so that's not really going to be an issue. I don't even know, the reason we're allowing the contractors on site, and to be honest with you, these will be the first real outsiders that have been up in the jail since March. So, this has not been a regular thing for us, but we just felt that, for our project, in order to get the most accurate numbers for bidding, that these people probably need to be, boots on the ground in the jail itself. And so, we want to make sure that they have a full understanding of everything that they're going to be tasked with. And the only way to really do that is by allowing them the access. So I don't even know if it's a situation where they're going to have to go actually into the housing units. I'm hoping not. But if they need to do that to get accurate measurements and things like that, obviously we need to help keep this project on track. So, we'll allow them a limited amount of time to go in, and we'll try to keep the inmates as far back from them as possible to help maintain safety.
Okay, thank you, Sheriff Kennedy. I'll just, from my experience, I'm kind of surprised that if most of it isn't done by available technology that already exists without them having to be on site. But I understand if somebody want, as you said, boots on the ground, or as I would say, maybe putting their eyeballs on it in person, might be necessary for a project of that scope. So I understand. I just wanted to make sure that the public was comfortable with our protocols.
Yep, no problem. Yep.
Okay, thank you. Any questions, any additional questions for Sheriff Kennedy?
None for me.
Okay, thank you, Sheriff Kennedy. And as Sheriff Kennedy said, there'll be a public hearing on December 14th for comment from the citizens. So, all right, we do have, we are a little ahead of schedule now. So I'm going to ask for a motion to recess until 11:30 is when our next
So
work
moved.
session.
Second.
Okay. Motion made and seconded to recess until 11:30. At such time, we'll have the work session with the county attorney and zoning administrator regarding update on zoning violation. So all in favor signify by saying aye.
Aye.
Aye. Carried 3-0. We are in recess. Thank you all. Okay, I think we're about ready to start our 11:30 a.m. work session with County Attorney CJ May and our zoning administrator Tammy Henry regarding an update on zoning violation. And so we'll turn it over to CJ and Tammy.
Okay, CJ, I'll step in. Can you hear me, everybody?
Can hear you just fine, Tammy.
Okay, so I'm just following up with the Knapp Mobile Home Park and trying to give you an update of what the status is and how that's going right now. And so I was out there December 1st. And as you can see, we attached in a packet for you some pictures so you can kind of see some of the progress that's been going on. I have not spoke with Ms. Knapp, but I have spoke with Mr. Hoyne. So Ms. Knapp has decided that she would hire Mr. Hoyne to do the project. So she has hired him to do that. He has removed 3 of the mobile homes, and they're the ones that I will tell you that were closest to the track area. Those first 3 mobile homes have been removed. And as you can see, I provided you some pictures of the progress. There was still some piles of debris and stuff. Now, again, that was December 1st. I spoke with Mr. Hoyne this morning, and he let me know that a lot of that's been cleaned up. And he is now working on what I'm going to call the blue trailer on the corner, which would be in your packet. I'm just scrolling down through the pictures. Will be the one that I have marked as number, sorry about that. I have it marked as number 15 on your, as you'll see on the pictures, it's marked as number 15. That one is the one where he's currently working on it. And that one he's hoping to have removed by the end of the week. They've got the windows out of it, he told me, and they're making progress. Then there'll be the one that is at the very end of your packet, which will be number 19, 20, and 21 as marked on the pictures. That's the one that sits all the way to the end. It's really considered trailer number 1. That one will be removed hopefully he's also hoping within the next 2 weeks. Now, he has about 5 mobile homes left to take. There are 2 more in the middle and 1 up on the hill. That one that you're seeing right there, number 33, that will be one of the ones that's going to get removed as well. It hasn't actually been removed yet. So he was telling me this morning that, of course, weather will make a little bit of difference here, but his goal is to really have all of these removed, hopefully by the end of the month, the first week of January is what his goal is. And that he has also told me that he has already removed like 50 tires, and there's probably 50 more. And you know, these tires just keep showing up on this property. So hopefully when all this debris is removed, now that's number 20 that you're seeing. That is the one that sits alone by itself. That one's going to be removed hopefully in the next 2 weeks as well. So there is progress being made. Mr. Hoyne is the one that has been hired to do the project, and he's keep in touch with me on what's going on. And I, you know, again, I don't know where CJ's at with some of his stuff. We did talk this morning, and I know that, you know, basically there's progress being made, and it's really in Mr. Hoyne's hands now. Does anybody have any questions for me?
Tammy,
Have a comment, Tammy, Dave Baker here. We have been, you know, we've been dealing with this since I came on the board, and I think our predecessors, and I know Supervisor Wickham is the most senior member of the Board of Supervisors, and he's been dealing with it since he came on. I think having, you know, Mr. Hoyne working on this is great, and appreciate the efforts, and also, you know, even though it's taken a while, the cooperation obviously from Ms. Knapp in regard to actually moving forward with this. And I think that's been helpful with Tammy, with your involvement and CJ's involvement to getting this thing moving. And that's it's just good news. And I guess I'm willing to not look back and try to look forward and getting this done. There are some very good people that live in that park that have been putting up with, having these abandoned structures around them. And so I feel good for those folks that their park is being cleaned up, and hopefully this going forward, then they'll better maintain this property. But have confidence that Mr. Hoyne will do a good job and get it cleaned up.
Tammy Ann McDonough, I had a question for you. I know you were going to speak to Mr. Hoyne this morning. I'm glad you connected. Do you know if he's been paid?
I did not ask him that, but he did not seem to be concerned about it. So in his beginning conversation with me, he had made the comment that, I'm going to take a few out, and if she doesn't pay me, I'm just going to wait. And in my conversation with him this morning, it didn't sound like that. So he sounded like he was confident that he was going to keep moving forward. And the only thing that can delay him a little, obviously, is some weather.
Sure.
His regular job is snow removal and things like that. So if he gets a snow day or something, they'll end up backing up. But his goal was to try to everything done here by the end of the month to the beginning of January is what it was. And then we did talk about prioritizing. So he is going after what I'm going to call the blue trailer on the corner. And then his next one is to get the isolated brown trailer, because those would be major eyesores right on the top in the front. And then he'll go back into, there's a couple in the middle of the ones going towards the Dubuque side that way. And there's one way up on top in the corner. And we both agree that that should be the last one if the weather stops it from progressing. That one is like out of sight. And so would be the, one he'll need to remove, but maybe not top priority to start.
Tammy, how many trailers do we think are going to end up there that are actually going to be habitable in any argument, in any meaning of the word?
Anne, I'm not really sure. I can look at that. I do know it looks like there's 8 scheduled to be removed, and he's removed 3. So I really don't know. I think there'll be, let me see, 1, 2, 3, 4, 5, 6, 7, 8. There may potentially be maybe 10 to 12 left. Now, I know some of them don't look in great condition, but there are people living in them.
Of course.
And our goal would be to get through this first stage of getting the removal of all these abandoned ones. Then the next goal, and I spoke with CJ about this morning, would be to work with the remaining people and Miss Knapp to clean up those other properties that are there, the ones that are actually being lived in and still look a little messed up. We'll go ahead and try to work with them and try to work with Amy about them maintaining their own properties once we get all this other stuff going. So we're moving forward, and I'm ecstatic that there's progress being made. It's been a long time. We've been working on this a long time.
Yeah, Supervisor Wickham, I too am also pleased with the progress, and I think having the trailers that have been removed have eliminated a safety issue related to fire, drug and crime issues, illegal dumping, and then lastly, but on the list, as far as just overall aesthetics for those that currently live in the neighborhood and or drive by. So good work in the progress so far, and keep moving.
That's the goal.
I am interested in the status of, or I guess County Attorney May's way forward in looking at some kind of a stipulated agreement. I'm not trying to be the heavy here, but I think always planning on what our next steps are going to be, because of the past history of forward some progress and then stall. So I'm pleased too that progress has happened, but just wondering, CJ, if you've been able to communicate with Ms. Knapp, and does it appear from a legal side that there's a potential agreement of some kind?
And I have not spoken to her directly. I felt Tammy was, a good contact person with her and had sort of a relationship, if you will. And So I know when we had our meeting, I think according to my notes, October 26th, and Ms. Knapp was on the phone, she identified that she herself thought there were 8 trailers that needed to be removed. And I think that seems to be the common denominator here. So now that 3 are gone, I guess after I talked to Tammy this morning, I think my thoughts are to identify the remaining 5 by lot and or address number, whichever it may be. And then I can make some direct contact with Ms. Knapp to get something in writing with her, just to sort of that would outline the schedule of removal to the best, given our climate and whatnot and weather, but and that it would contain some language that, if she doesn't comply within reason, obviously that, the county would pursue other lawful remedies that we may have. But I think that the key here certainly is, you all have seen and identified, is that progress has been made, and whether it's because she feels the pressure or whatever, but I think she should be commended for taking the steps that she's taken, and not putting us in a spot where we do have to file some kind of legal action to get it going in that direction. And as well, quite frankly, even though the courts are open, they're kind of not open for much civil activity. So we would be looking, probably, my guess would be something in like 2023 would be my best guess, probably at this rate. So 2022 for sure. So I'm glad that we're moving like we are here. And I think I want to thank Tammy for all she's done, because she really has stayed on top of this, and it's helped move the needle. And just as she has a good relationship with Ms. Knapp, I know she knows Mr. Hoying pretty well, in a working relationship in a business sense, and that helps the whole thing move together. So those are my intentions at this point, kind of moving forward.
I appreciate the update from both of you. Thank you.
Sure.
And CJ, if I may, I forgot to mention this morning. So the one thing that Ms. Knapp has mentioned to me is she wanted that draft done of the stipulated agreement from what will happen in the end. If you all may recall, Ms. Knapp is interested in at some point making sure that her property does not have that county easement through there that we currently have. She has mentioned to me that would make the property easier to sell someday. So at some point, CJ, as we move forward, that will be something that she wants to make sure we have something in writing on.
Yes.
That allows us to give back that access that she's used, that the park's used since the 60s.
Yeah, Tammy, I either don't hear you well there, or can you reframe what you're saying? What goes through it?
Okay, so there is a county right-of-way that goes through the front corner of that park.
Okay.
And we are not giving that up until the park is cleaned up, pretty much. And Amy would like that back someday. So that was a conversation that we've had with her, and that was part of the stipulated agreement eventually that we would make with the county. And Anthony has mentioned that would.
I don't know if we agreed on that. I wouldn't be just throwing that out, that was stipulated and agreed upon.
I know it was conversation, excuse me, Supervisor Wicken. It was conversation at one time, and I know that Amy picked up on that.
Agreed, conversation, that's
Okay.
not agreement. So yeah, there is an old right-of-way that goes through there. In fact, the trailer in the corner is actually in that old right-of-way, and it's probably not permitted to be there. So it definitely needs to be removed. Yeah, I think we're making progress, but I wouldn't get your eyes too excited. We've been at this similar spot a few years before. So I think the onus, unfortunately, is on removing those at-risk trailers that are safety issues. And once those are done, then we probably can move on to secondary conversations. But prior to that, I think it's all conversations are premature.
Good points. I appreciate your input, Supervisor Wickham. I didn't know about the right-of-way issue. I think I read it in a huge file, but I appreciate the perspective.
And I think that this is Supervisor Baker, the right-of-way issue is, that's some leverage that we have. And I think that I wouldn't prematurely be wanting to release that I think we need to hang on to that because of the track record and all that. But I will comment, the previous contractor, I will say that Mr. Hoyne looks like from the slides and the drive-by that is doing a better job cleaning up, tearing down and then cleaning up the site than the previous contractor that she had hired about 4 years ago or whatever that was. So, all right.
That's obvious, Supervisor or Chair Baker, that's obvious. We don't have the debris blowing out on the road.
Yeah.
It's like they're removing them in a chunk and taking them and they're not being stripped apart.
Yeah, it's a big difference that I can see. So,
Right.
Tammy, thank you for your efforts on this, and CJ, thank you for your efforts. This is good stuff, and I think we're moving in the right direction.
I'd
Say that
like to-
cautious. I'm cautiously optimistic.
Right, and I'm wondering, when are we going to check back? What's our check back time? I don't want to leave it be for further another citizen to complain. What's our plan? What's the reasonable time?
Well, and if I may, Supervisor McDonough, how about we look back at a 2-week period, maybe towards the end of the month? Getting towards you, I know that you're doing your Monday meetings, so maybe we could put something back together on the 28th, and then I would be able to get out, take some more pictures of the site, kind of see where we're at, and give you an update there if that would work for you.
That's fine. I'd even accept 30 days, just so we can see that. I just want to keep it
Sure, absolutely.
on the agenda, not necessarily, we've got other things that we're going to have a full calendar till the end of the year. I know. I think Chair Baker's got some things he'd like to get concluded that he's worked on. So
Sure.
I'd
Sure.
like to support
And
that as well.
if you want it for 30 days, I can just set it on the calendar that we can give you an update in 30 days.
Does that seem reasonable to everybody?
I'm fine with that.
It's reasonable to me. Just copy me in on my personal email.
Sounds good. We can do that.
And Tammy, I'm gonna go out and visit with Ron and Ann Shaw, and I kind of dubbed Ron the mayor of Knapp Trailer Park, and their place is always kept up real nice, and they keep in touch with us about what's going on out there. So I'm going to check with them, and I'll get with you if they have any news or anything like that. They keep a good eye on things out there.
Yeah, Chair Baker, I think they've been out there almost 40 years.
Yeah, good people.
Yeah, they are. So.
Yeah.
Okay, all right. If you need anything else, just let me know, and otherwise we'll put it on the calendar to try to do something within around 30 days.
Okay, thank you.
Thank you.
Thanks, Tammy. Thank you, CJ.
All right, we have we can roll into our next agenda item because it's not time certain here. So the next item is resolution regarding appointment of deputies, assistants, and clerks. So let's go to Dawn Sherman for that. And it is a resolution.
We'd have a resolution for 2 Sunnycrest permanent part-time food service workers. And again, this will help with their overtime. So we're recommending approval.
Motion to approve.
And I will second that.
Okay, motion made and seconded to approve the resolution. And is there any discussion? Hearing none, all in favor signify by saying aye.
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 Aye, carried 3-0. Okay, next up is we have a media release, and we're looking for formal approval to move forward with the media release. And I think we'll go to Stella Rundy and Ed Raber for this. You can see it up on your screen there. So
this is the media release you asked me to draft and bring back to you today. So I sent that to you for you to read, and then this is the formal approval for this release, and then we would distribute it through our media channels.
I'll move approval.
And I will second that.
Motion made and seconded to approve the media release. Any additional discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Okay. Next up is public comments. At this time, anyone may address the board on matters which are of concern to that person and which are not agenda items. Please go to the podium if you're at the courthouse, or contact us via chat or raise your hand on Zoom, and give your name and home address. And please be aware that the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. So we'll take an appropriate amount of time here to see if anyone wishes to speak in the public comments portion of the meeting.
Chair Baker, I see no notifications for public comment.
Okay, then as the next meeting is our regularly scheduled meeting for the Board of Supervisors, the appropriate motion would be a motion for adjournment.
So moved.
Second.
Okay, motion made and seconded to adjourn. All in favor signify by saying aye.
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 Carried 3-0. I show us adjourned at 11:51 a.m. Thank you all. Have a great day and be well.
Thank you.